In an era where human potential seems boundless, it's easy to overlook the silent architects of our progress. From the moment we are born, we are cradled by technologies that extend our lives and enhance our well-being, a testament to a relentless quest for knowledge that began centuries ago. This is the story of medical technology, a journey from crude observation to profound understanding, and how it has fundamentally reshaped the human experience. Our journey begins in the 17th century, a time when the world was far larger and more mysterious. With simple, handcrafted lenses, pioneers like Antony van Leeuwenhoek peered into a drop of water and discovered an entire universe teeming with animalcules. This was the dawn of microbiology. For the first time, humanity could see the invisible agents of disease, shifting the cause of sickness from divine wrath or miasmas to tangible, observable organisms. The microscope didn't just magnify life, it magnified our understanding, setting the stage for a revolution in medicine that would save countless lives. Building on this discovery, the 19th century became a battlefield against these unseen foes. Visionaries like Louis Pasteur championed the radical germ theory, proving that microorganisms were responsible for fermentation and disease. This breakthrough led to pasteurization and, critically, the development of vaccines. Simultaneously, figures like Joseph Lister, horrified by post-surgical infections, introduced antiseptic practices. Suddenly, the operating theater, once a gateway to death, transformed into a place of healing. The simple act of sterilizing instruments and washing hands became a powerful weapon, drastically reducing mortality and heralding a new era of surgery. As we moved into the 20th century, the focus shifted from seeing the microscopic to seeing within the macroscopic. Wilhelm Röntgen's accidental discovery of X-rays in 1895 gave doctors a non-invasive way to view the human skeleton, revolutionizing diagnostics and fracture treatment. This was just the beginning. The invention of the electrocardiogram, ECG, allowed us to listen to the heart's electrical rhythm, while later innovations like CT scans and MRI technology provided breathtakingly detailed, three-dimensional views of our internal anatomy. The body was no longer a black box. Its secrets were being revealed layer by layer. With the ability to see and understand disease, the next great leap was in preventing it. The 20th century will be remembered as the age of the vaccine. Following the early success of the smallpox vaccine, scientists developed immunizations for a host of devastating diseases, including polio, measles, and tetanus. Global vaccination campaigns, massive logistical and scientific undertakings effectively cornered these ancient killers. The eradication of smallpox and the near elimination of polio stand as monumental achievements, a testament to how proactive medical technology can transform public health on a global scale. Today we stand at the threshold of yet another new frontier. The convergence of biology, data, and engineering is unlocking possibilities once confined to science fiction. Artificial intelligence is helping to diagnose diseases with superhuman accuracy. Gene editing tools like CRISPR offer the potential to correct genetic defects at their source, and robotic surgery allows for procedures with unprecedented precision. We are entering the age of personalized medicine, where treatments can be tailored to an individual's unique genetic makeup, promising a future of proactive, predictive, and personalized care. From the first crude lens to the complex algorithms of today, the evolution of medical technology is a story of human ingenuity and our unyielding desire to live longer, healthier lives. It is a legacy written in the laboratories, hospitals, and clinics around the world, carried forward by each new discovery. This continuous cycle of innovation ensures that for generations to come, the boundaries of what is possible in human health will continue to expand, shaping a future brighter and more resilient than we can currently imagine.